Obesity is a complex disease involving an excessive amount of body fat. Obesity isn't just a cosmetic concern. Overweight and obesity are major risk factors for a number of chronic diseases, including diabetes, cardiovascular diseases, and cancer. Obesity is a leading preventable cause of death worldwide, with an increasing rate in adults and children. In 2015, 600 million adults, or 12% of more than 1.9 billion adults, were overweight. Obesity is most common in women than men. Authorities view it as one of the most serious public health problems of the 21st century. The fundamental cause of obesity and overweight is an energy imbalance between calories consumed and calories expended. An increased intake of energy-dense foods that are high in fats and sugars, and an increase in physical activity due to the increasingly sedentary nature of many forms of work, changing modes of transportation, and increasing urbanization. People are generally considered as obese when their body mass index, or BMI, and BMI is a measurement obtained by dividing a person's weight by the square of the person's height. So, a person with a BMI of 30 or more is generally considered obese, and a person with a BMI equal to or more than 25 is considered overweight. Obesity is most commonly caused by a combination of excessive food intake, lack of physical activity, and genetic susceptibility, but also exists other possible contributors to increased obesity, such as insufficient sleep, endocrine disruptors, environmental pollutants that interfere with lipid metabolism, decreased variability in ambient temperature, decreased rate of smoking, that's because smoking suppresses appetite, increased use of medications that can cause weight gain, or atypical antipsychotics, proportional increases in ethnic and age groups that tend to be heavier, pregnancy at a later age, which may cause susceptibility to obesity in children, epigenetic risk factors, fast and genes. Excess food intake is the primary factor for developed obesity. A few cases are primarily by genes, endocrine disorders, medications, or mental disorder. The view that obese people eat little yet gain weight due to a slow metabolism is not medically supported. On average, obese people have a greater energy expenditure than their normal counterparts due to the energy required to maintain an increased body mass. Obesity is mostly preventable through a combination of social changes and personal choices. Changes to diet and exercising are the main treatments. Diet quality can be improved by reducing the consumption of energy-dense foods, such as those high in fats or sugars, and by increasing the intake of dietary fiber. Medications can be used, along with a suitable diet, to reduce appetite or decrease fat absorption. In 2013, several medical societies, including the American Medical Association and the American Heart Association, classified obesity as a disease. And here's the classification of obesity. Below 18.5 BMI is considered underweight, 18.5 to 24.9 considered as normal, 25 to 29.9 is considered overweight, and 30 and higher is considered obesity. Any BMI greater than or equal 35 to 40 kg per meter squared is severe obesity. A BMI of greater than or equal 35 or 40 to 44.9 kg per meter squared and experiencing obesity-related health conditions is morbid obesity. A BMI of greater than 45 or 50 kg per meter squared, is super obesity. Number of reviews have found that mortality risk is lowest at a BMI of 20 to 25 per kilogram per meter squared. On average, obesity reduces life expectancy by 6 to 7 years. A BMI of 30 to 35 kg per meter squared reduces life expectancy by 2 to 4 years, while severe obesity or those with a BMI greater than 40 kg per meter squared reduces life expectancy by 10 years. Health consequences caused by obesity fall into two broad categories. Those attributable to the effects of increased fat mass, such as osteoarthritis, obstructive sleep apnea, social stigmatizations, and those due to the increased number of fat cells, such as diabetes, cancer, and cardiovascular disease, non-alcoholic fatty liver disease. Obesity increases the risk of developing serious illness from coronavirus disease 2019. Obesity also increases risk of these following diseases: coronary heart disease, angina, and myocardial infarctions, congestive heart failure, high blood pressure, abnormal cholesterol levels in diabetes mellitus, polycystic ovarian syndrome, menstrual disorders, infertility, complications during pregnancy, birth defects, some cancers including endometrial, breast, ovarian, prostate, liver, gallbladder, kidney and colon, stroke, melalgia paresthetica, migraines, carpal tunnel syndrome, dementia, idiopathic intracranial hypertension, multiple sclerosis, depression in women, social stigmatization, gout, poor mobility, osteoarthritis, and low back pain. Overweight and obesity, as well as the related non-communicable diseases, are largely preventable. Supportive environments and communities are fundamental in shaping people's choices. By making the choice of healthier foods and regular physical activity are the easiest choice and therefore preventing overweight and obesity. And at the individual level, people can limit energy intake from total fats and sugars, increase consumption of fruit and vegetables, as well as legumes, whole grains, and nuts, and engage in regular physical activity, 60 minutes a day for children and 150 minutes spread through the week for adults. The food industry can play a significant role in promoting healthy diets. By reducing the fat, sugar, and salt content of processed foods, ensuring the healthy and nutritious choices are available and affordable to all consumers, and lastly, restricting marketing of foods high in sugars, salt, and fats, especially those foods aimed at children and teenagers.